Currently, the obesity rate in the United States is one of the highest in the world, leading to spiraling medical costs and problems like type 2 diabetes, hypertension, and cardiovascular disease. Well, we are fortunate to have a pioneer in weight loss surgery right here in the Triangle who's treating patients with the procedure that the FDA just approved for patients who would not have qualified before. Dr. Paul Enochs, Dr. Same Toma, and Sarah Plaskowski join us to talk about the Lap Band. Welcome to everybody.
Thank you.
First, Dr. Enochs, tell us what this Lap Band thing is.
Well, the Lap Band is a surgical device that actually can be placed around the top of the stomach, as you can see in that model there. And the purpose of it is it creates a little pouch above the stomach with a larger the rest of the stomach below, and it allows patients to lose weight by giving them restriction.
And it's adjustable. That's the whole point of it, right?
Yes, exactly. The band is connected to a port that sits below the skin, and by using that port to access it and place fluid inside it, it can actually allow the band to get a little tighter or looser depending on how patients need restriction.
Now, how is this different from a gastric bypass? I think most people have heard of gastric bypass surgery.
Yes, a gastric bypass is actually, it's a more invasive procedure. It's a permanent procedure where we divide the stomach and bypass 25% of the small intestine.
It's major surgery.
Yes, it is.
And this is much less invasive. You do with little holes.
Correct. It can be done laparoscopically through small little incisions. That's
okay,
correct.
so Sarah, you are one of Dr. Enochs' Lap Band patients, and what has your life been like from the before Lap Band procedure to the after? And your pictures are quite amazing, the transformation you made.
Thank you. I think before the procedure, I had gotten to a point of, I had plantar fasciitis severely. I couldn't walk in the morning. I had sleep apnea, and I think there was just a lot of self-loathing going on with how I'd let myself get to that point. And having the surgery...
And you tried a lot of different diets and couldn't keep it permanent?
Correct. From my early 20s, I had been dieting, and I decided to go see Dr. Enochs. I had the Lap Band surgery, and I have lost 57 pounds so far. I no longer have plantar fasciitis. I don't snore anymore.
And you're avoiding all the other potential things that happen
Exactly.
with obesity.
Diabetes ran in my family, so it was a risk, and heart problems, so I've avoided all that. So I'm really very happy with my results.
Now, Dr. Toma, once a patient like Sarah loses significant amount of weight, and other patients like that, there are other things that can be done to improve the cosmetic part of it.
Correct. We've started a practice that has incorporated the Lap Band and a lot of the aesthetic procedures in one practice for patients. And what Sarah, for example, could use after having Lap Band is she will have loose skin, although Sarah's young, so not as much. But the loose skin, you could do abdominoplasty or brachioplasty, where you remove some of the loose skin behind the arm, or even to just fine-tune and sculpt at the end. You could also do some liposuction.
So it's really sort of an overall long-term goal to keep the weight off and then look the way you really want to look.
Yes,
Sure.
We find that women, after having babies and start focusing on themselves and start thinking about weight loss and a lot of the aesthetic procedures that follow that.
All right, a one-stop shop for all of it. Sarah, Dr. Toma, Dr. Enochs, thanks so much.
Thank you.